How do you tell a good clinic from a bad clinic? What do you recommend people?
We'll take a couple things. We'll take hormones and weight loss. If you're going in because you feel maybe you're deficient in some hormones, there's some biomarkers, some markers that these doctors need, these providers need to pull to be able to look at all your systems to make sure that if they do treat you, that they're not gonna cause problems other places. That's one of the first things. If you go in and they're pulling your testosterone and that's pretty much all they're pulling, yeah, you need to get out and you need to go somewhere else. Because when you do hormone replacement, there's things we need to look at your blood cells. We want to look at your liver and kidneys. We want to look at certain vitamin deficiencies, which could hamper how you absorb certain medications. When we're looking at hormones, don't want to just look at testosterone. We need to look at estrogens. We want to look at your FSH and LH receptors. When you pull a thyroid, the thyroid is probably one of the most misdiagnosed problems that we have, right? Because when you go to your doctor, when you go to your primary care, which most people do, your primary care is only going to pull a TSH, thyroid stimulating hormone. That's how they've been taught. That's how they've gone for years and years and years, is if you pull your TSH and that's out of whack, then you know, okay, you have clinical hypothyroidism and you treat it. But what they don't seem to understand or don't want to do based on insurance protocols is TSH is really telling me what your pituitary is doing. It doesn't tell me what your thyroid is doing. We need to pull a full thyroid, free T3, free T4, TSH, and then with us, we pull also thyroid paradoxase, which is TPO, so that we can see if you have any autoimmune that might be causing problems. And believe it or not, we find people all the time that have Hashimoto's, thyroiditis, and nobody's ever told them. Their doctor's basically telling them that their thyroid's fine because they're only pulling TSH. So just understanding that you want to have all the best information up front as a provider to treat the patient properly. It's pretty simple. They just don't want to do it.